2015-2016 marked the midway point of Eastern Health's 3-year strategic plan, Together We Can. It has also marked 12 months of innovation, medical advances, and a shared commitment to enhance care to those we serve. As we strive to realize our vision of healthy people, healthy communities, we are guided by 4 priorities: quality and safety, population health, sustainability, and access. Eastern Health is committed to increasing the quality and safety of all its services along the full continuum of care. As we look back over the past year, it seems fitting that we highlight an initiative that taps into memory as a way to enhance quality of life. The Music in Memory program uses iPods to offer personalized music to seniors living in our long-term care homes. Music that is tailored to personal histories and favorite styles can trigger well-preserved memories, enabling the listener to reconnect with the world. For the long-term care resident, it can improve mood, enhance verbal communication, and physical activity. It elicits feeling of well-being and decreases agitation, anxiety, and depression. In some cases, it has actually encouraged non-verbal residents to speak again. Music in Memory bridged not only decades of memory, but the generation gap as well, as high school students collaborated with long-term care staff to collect the iPods for the seniors. From heartwarming to heart-saving, Eastern Health's cardiac care program introduced a new procedure early in 2016 to replace faulty aortic valves. Known as TAVI, which stands for Transcatheter Aortic Valve Implantation, it is used for high-risk or elderly patients who would not be able to tolerate open-heart surgery. An artificial valve is inserted through the artery on a wire, and when it reaches the right position, expands to widen the artery. Not only is TAVI an innovative collaboration between Eastern Health's cardiac and surgery programs, resulting in 20 to 24 procedures a year, it also reduces wait times and the length of a patient's recovery.
The way that we do it with a transcatheter valve allows us not to have to open the patient's breastbone. So in high-risk patients, we now no longer have to offer such an invasive procedure. So we can do a transcatheter valve, which takes about 2 to 3 hours to do. The patient can return home in about 2 days.
Population health involves a wide range of factors known as the determinants of health. Things like literacy, employment, housing, social support networks, health services, and coping skills. Eastern Health had a unique opportunity during the past year to make a huge impact on many of these determinants of health for a specific population, with the arrival of hundreds of Syrian refugees in the province.
Thank you for coming. It's really nice to see you. Can I sit here by you? Perfect. Hi. How's it going living in Canada?
In the beginning of January of 2016, and through the Association for New Canadians, Eastern Health has provided public health nursing services to newly arrived Syrian refugees. With only one full-time nursing resource associated on site, over 600 hours of public health nursing services were provided by nurses temporarily reassigned to the association.
Any place we go, we find very helpful people.
Eastern Health strives for excellence in everything we do, from the care we provide to the ways in which we manage our resources. Sustainability means making the best use of our resources, both human and fiscal. It involves efforts to increase the effective use of these resources, ensuring that the practices that we have in place today do not compromise our well-being in the future. Our greatest strength? The dedication of those who work at Eastern Health. With this in mind, Eastern Health has developed a healthy workplace plan, and during the past year has implemented a number of key components to help build a healthy and engaged workforce that is empowered to provide the best possible service to clients. This included the promotion of physical health and active living through various campaigns. Eastern Health has also offered presentations to managers on mental health in the workplace, including mental health first aid, to learn how to respond to someone who may experience a mental health problem, along with awareness of its employee and family assistance program and conflict management training to frontline employees and leaders, along with managers and directors.
And my hope is that the two of you will be able to come to agreement, that you will be able to do that.
Eastern Health is committed to improving access to its programs and services, and by working in collaboration with our staff and external partners, we believe that together we will improve access for our patients and clients and help to ensure more positive health outcomes for those we serve. Eastern Health's Mental Health and Addictions program took a significant step forward in February 2016 with the opening of a new addiction center in Harbor Grace. The Grace Center is an 18-bed facility offering intensive care for adults dealing with complex alcohol and drug addiction issues. It provides medical, therapeutic, and educational services in a safe and home-like environment and complements other existing addictions treatment facilities in the province to increase access to care.
Most people that we see have been so thankful, so appreciative of the fact that they have somewhere else to go.
Sometimes access involves something as basic as shelter. Eastern Health's Mental Health and Addictions program has entered into a unique partnership with Stella Circle and End Homelessness St. John's to provide housing and supports to individuals experiencing long and frequent episodes of homelessness. Some people with mental illness experience homelessness, and partnering with community groups helps to increase access to fundamental supports that often result in more positive health outcomes for those we serve. At Eastern Health, our doors are open. These examples are just some of the ways we stand ready to serve, to offer quality service along the full range of care, today and in the days to come.